Well, it's just gone 2 o'clock, so I think we might get started. We've got quite a few online, so a very warm welcome to this Deliver webinar on this glorious late autumn afternoon. The topic of interest today is supporting clinician-led research in regional settings, clinician and manager perspectives. So before we hear from our two fabulous speakers, I would like to take a moment to acknowledge the traditional owners of the lands on which we all meet, learn and work on today. So I am on the lands of the beautiful lands of the Wadawurrung people of the Kulin Nation, and I pay my respects to their elders and ancestors and thank them for allowing me to host this virtual gathering on their land. And I acknowledge their continuing connection to this country. I extend that respect to any Aboriginal and Torres Strait Islander people joining us today. And I encourage you to use the chat function to acknowledge the traditional owners of the lands on which you are joining this webinar from, if you would like to. So we will be hearing from two fabulous speakers today, as I mentioned. They are both from Grampians Health, and they will be sharing with us their experiences of clinician-led research. So first we will be hearing from Harvey, who will share his experiences as an emerging clinician researcher. And then we'll hear from Georgie Kemp, Director of Allied Health and Ambulatory Care, about her experiences and perspectives on supporting, encouraging and enabling research activity in healthcare settings. So we certainly look forward to question and discussion time after these two presentations. So if any questions pop into your head, please jot them down. And I'll just ask that you hold your questions for each speaker until the end of the session. So for those of you who've just joined, we are recording this session to make it available for those who are not here. So you are welcome to switch off your camera if you'd prefer that. So before we get started, did anybody have any questions or any technical issues that they just wanted to bring up? Or are we all good to go? All right, looks good. Well, Jai, if you'd like to just start sharing your screen, I will just introduce you. So Jai is an exercise physiologist at Grampians Health in Ballarat. So he also has an interest in research, which began when he completed his thesis as part of his master's degree. And he's since participated in the STAR program, where Jai has continued to develop his research skills and is leading a project in pulmonary rehab program at Grampians. So over to you now, Jai.
All right, thanks for the introduction, Olivia. Start with a bit of an introduction. Firstly, just good afternoon, everyone. Hope everyone's doing well. As Olivia alluded to, my name's Jai Harvey, and for the past 2 years, I've had the privilege of working as an exercise physiologist at Grampians Health, Ballarat. In my role, I'm primarily involved in our cardiac and pulmonary rehab programs, as well as our amputee rehab program and some community-based programs through our CHISP and HAC funding. Initially, I'd just like to thank the Western Alliance and Deliver team for inviting me to speak today and provide a bit of an overview of my early research journey as a clinician who is pursuing research. It's an honour to be here among fellow healthcare professionals who share a commitment to improving patient care through research and evidence-informed practice, or just wanting to learn a little bit more about the journey of someone pursuing research early in their career. So throughout my presentation, I'll dive into some of the factors that have enabled and challenged my research pursuits, share some insight from my own personal journey, as well as provide an overview of my current research project, as well as discuss some aspirations for my future research plans. I thought I'd start with just a little bit of a background on me and my research journey. So my journey in research began with the completion of my master's in clinical exercise physiology at Fed Uni in 2021. This obviously involved a thesis component and provided the opportunity to dive into research and provide me with those foundational skills and knowledge of conducting a research project from start to finish, while being in a very extremely supportive environment. So my actual thesis project was actually conducted with Grampians Health Ballarat, and we conducted a retrospective cohort analysis of the pulmonary rehab program over a 1-year period. We were primarily interested in the effect of the 8-week program on exercise capacity, quality of life, and breathlessness, as well as seeing if there was any correlations between these 3 main variables. I'm currently in the process of refining and preparing this project for publication, where I aim to contribute valuable insights into the field of pulmonary rehab. Following the completion of this project, I've had the privilege of sharing these findings to the broader healthcare community. At the end of 2021, I presented virtually at the Ballarat Health Services Research and Innovation on the Run conference, and then the following year in 2022, I presented at the ESSA Research to Practice conference, where I presented a poster highlighting the key findings and implications of the study. I've now commenced another research project, again through the Grampians Health Pulmonary Rehab Program, where I aim to build on the thesis I completed in my master's, the many limitations that were identified in my thesis, as well as address a large gap within current pulmonary rehab research. Probably a good leading point into what drew me to actually pursuing further research as an early clinician as well. So this was mainly just
Jai, sorry, can I just stop you there? I'm so sorry to interrupt. Your slides aren't advancing for us, but I'm not sure if that's deliberate.
Right.
Yep.
So,
okay.
Yeah, I'm just talking through this slide, and then I'm about to go through. Thanks, Olivia. Yeah, so what actually drew me to pursuing a bit more research? So it was mainly a desire to continue to I guess, learn the process. So despite actually completing my thesis, I feel I wasn't completely exposed to all the background work that was associated with the project. For example, the protocol development and ethics application, it was realistically completed by those supervisors and lecturers, with me just having my small bits of input and making sure that it was all coming together and making sense. So I guess my main motivator there is I wanted to actually experience this and learn these skills for myself and continue to build on those foundational skills and concepts that I learned going through my thesis. Another reason I wanted to pursue more research was having the ability to identify the limitations that were actually in my thesis and have the ability to address these in a second research project was a huge motivating factor for me. The potential for a project that was led by me to potentially work towards addressing a large gap in pulmonary rehab research, as well as, again, potentially influence change within one of our own programs. Again, believe it or not, when actually doing my thesis, it was something that I was dreading initially, but it was something that I did come to, I guess, enjoy a little bit. I got a lot of satisfaction from it, especially at the end of it, seeing the completed project. So the write-up, reading the articles, appraising the literature is something that I grew to actually somewhat enjoy. And yeah, as I said, seeing that finished product was just a huge thing for me. Felt absolutely amazing. And then I guess there's a little other interpersonal motivating factors, such as the potential for career progression and growth through pursuing a research project. So next thing I wanted to speak about is just a little bit of a timeline of events for me. So in terms of my academic background, in 2018, I completed my Bachelor of Exercise and Sports Science before I had a year off uni, and then recommencing the Masters of Exercise Physiology in 2020 and finishing that the following year in 2021. The actual journey of pursuing further research as a clinician started in early 2023, where I discussed the idea to build on my thesis and the actual feasibility of this within one of our weekly pulmonary rehab team meetings. Straight away, the team was extremely supportive, and I had lots of people around me helping me out, especially Michael Pang. He was a huge motivating factor, and he recommended presenting my idea to the Merry Council. And he was then, again, huge in the support. He assisted to organise the presentation with the council, as well as helped with my own personal preparation of the presentation. So fast forward about a month is when I actually presented the idea to the Merry Council, and again was met with an extremely supportive environment, and the presentation was sort of used as a very safe space to discuss the initial questions and challenges that I found when commencing the project. So my main talking points were around heterogeneous nature of the cohort, or the mixed chronic respiratory disease diagnoses, which I'll touch on a little bit later as well, how data analysis might occur, as well as the combined retrospective and prospective nature of the data collection. Following these discussions with the council, I felt much more confident in taking those initial steps to commence the project and had a much clearer view of the actual methodology. So following the presentation, I was strongly encouraged by the likes of Michael Pang and Alicia Sainer to apply to participate within the STAR program. So those who don't know about the STAR program, its key objective is to build research capacity and capability across health settings in Western Victoria. It is a mentored training program for new practitioner researchers, and the overarching aim is to provide support and knowledge to develop an actual research idea into an actual research protocol or proposal. So there were 3 workshops all up. The first one was face-to-face, the other 2 were online over about a 3-month period, and I completed the last workshop in November 2023. As I said, it was a mentor training program, and I was lucky enough to have Alicia as my mentor. So we initially started with fortnightly supervision sessions where I'd discuss things like just my progress of the protocol, address any questions or challenges or personal reflections I might have had. So from this, to today, I've commenced the process of the protocol development and ethics approval, and still currently working my way through this process. Onto the next area, I wanted to provide a little bit of an overview of the research project that I'm pursuing. So we started with, firstly, we identified a problem area. So this shows that the problem area we identified is that previous pulmonary rehab research is focused on more clinical trials compared to real life clinical practice involving groups of those single diagnosed chronic respiratory diseases with an emphasis on COPD. These programs are generally 12 weeks in duration with 3 exercise sessions per week and have extremely favourable results towards pulmonary rehab, showing improvements in exercise capacity, quality of life, breathlessness, as well as decreasing hospital admissions and mortality rates. So despite what's actually demonstrated within the research, generally due to site and implementation issues, the majority of those outpatient and community pulmonary rehab programs, especially in the regional demographic, they will generally only be 8 weeks in duration with twice weekly exercise. And they also involved a mixed chronic respiratory disease cohort rather than just the single diagnosed respiratory disease cohort. So the current evidence on this, so to our knowledge, there are only a few studies that investigate a real world clinical practice pulmonary rehab program that involved that mixed chronic respiratory disease cohort. So in 2021, that's when I completed my thesis, the Grampians Health Ballarat pulmonary rehab program demonstrated very different results as to what was expected compared to the current pulmonary rehab literature. Although in saying this, we do need to recognise there were many limitations involved in this project, mainly being the small sample size of only 19, as well as a lack of complete pre and post data sets from those who actually completed the program. So there was only about 35% of those who actually completed the program had all 3 outcome measures listed in the spreadsheet. So this obviously may have influenced the results that we found. So this inconsistency in results was further supported by a study out of Canada in 2022, which followed an extremely similar structure to the one that we see at Grampians Health Ballarat. It's a publicly funded outpatient pulmonary rehab program that went for 8 weeks with twice weekly exercise. So this study found that in the chronic respiratory diseases other than COPD, again, very inconsistent results in terms of the benefits of the program. So it led us to think, is an 8-week, twice weekly exercise program sufficient in improving outcomes in chronic respiratory diseases other than COPD? So this leads into, I guess, our project plan and how we plan to hopefully contribute to the research of these side of things. So again, similar to my thesis, I aim to conduct a retrospective cohort analysis of the pulmonary rehab program at Grampians Health, although it's over an extended period, so aiming for 5 years. This obviously to address the small cohort we had in my thesis. Our primary outcomes of interest remain exercise capacity, quality of life, and breathlessness, as well as seeing if there's correlations between those variables. But we also, within the program now, look at grip strength as well. And we also want to see if those who complete the program have decreased hospital admission rates compared to those who don't actually complete the program. With the larger numbers, we also hope to do a sub-analysis according to the primary pulmonary condition, which again will give us greater information on the program itself and its benefits in other chronic respiratory diseases aside from COPD. So what do I actually hope to achieve from doing this research, or what does the team hope to achieve? Firstly, as touched on, addressing that large gap in pulmonary rehab literature, aim to contribute to and work towards addressing those inconsistent results of the single diagnosed chronic respiratory disease cohorts versus those mixed chronic respiratory disease cohorts. Help to understand if the 8-week, twice-weekly program is sufficient for other chronic respiratory diseases aside from COPD, as well as on a more personal Grampians Health level, gain greater understanding of our own program and help to identify focus areas for future quality improvement or even future research projects to help to positively influence change within our program. So the next thing I wanted to touch on is how Grampians Health will enable me to pursue research. So they've obviously been, for me, a major support in the pursuit of this research project. So firstly, as discussed, the support from the entire pulmonary rehab team, especially Michael Pang in the early stages, where he helped to organise the Mary Council meeting, encouraged me to complete the STAR program, answered all my questions, just made the steps going forward to be extremely clear, as well as introductions to others involved in the space, such as Alicia and John Hand from the ethics team. Aside from the pulmonary rehab team, the EP team at Grampians Health as well has been extremely supportive. I've been able to go to them and ask questions to those with more experience surrounding research. So those such as Megan, Luke, Jess and Tracy have been huge in allowing me to just pick their brain and go through all of that, as well as my manager as well, to help modify my timetable to have a little bit more time to work on the project. The next enabling factor was obviously the STAR program. That on its own was huge to help develop my knowledge and skills within this area, and just the ability to have access to 3 free workshops with the support from the managers around me for that PD leave as well. And then that leading into the mentorship with Alicia has been huge in enabling me to build my knowledge and pursue this project. And again, with Alicia, the introductions to her inner circle as well within the research field, people like Charlotte Molesworth, who's reviewing my data analysis section of the protocol as well. And then just to some other Grampians Health Ballarat resources as well that have been huge, people like Heath Miller and the IT team who are helping to create the hospital admission spreadsheet. And then of course, the library is a huge one that I'd recommend to anyone who's looking into pursuing research. They helped me out with a specific literature review in terms of those heterogeneous or mixed chronic respiratory disease pulmonary rehab cohorts. Really does take a lot of work away from things that you need to do. So were a massive help, especially in those early stages. So despite there being many enabling factors, of course, I've also run into a lot of challenges along the way as well. I think the biggest challenge I've faced, and I imagine would be the same with any clinician who's pursuing research, is the lack of time or perceived lack of time to actually work on the project. I think we just need to keep in mind that it might be frustrating, but we are actually clinicians first, and I wouldn't want to change that at all. I love being a clinician and working in the field I do. It's why I got into this field, to work with people and be a clinician. But I guess how I worked to overcome this challenge was just discussions with my manager, as I said, making modifications to my timetable, making sure I had the specific clinical versus project time that we're allocated in our EBA as well, So that really did help, as well as just finding the time as you can. If someone didn't attend, they DNA'd, you might wait around for 10-15 minutes of your initial assessment, and then you do your call, they say they're not coming or you can't get onto them, then all of a sudden you've got sort of 30-40 minutes to spend a bit of time on your project there. So that was another way of overcoming the time barrier. The really only other main challenge that I've noticed has been, as the project team has grown and there's more influence from others within the project, there's been obviously an increasing need to wait for those to do their part of the project. So the project was sort of hitting those very intermittent standstills. And again, just how I overcome this was just discussions with Alicia, my mentor, and her providing some other productive tasks to work on while I waited for everyone else to address their side of the project too. And an example of that was starting the ethics application side of things. So next point is what I wish I knew sooner. So first point is don't do it on your own, and to reach out to those around you. So I think that's something that I probably perceived myself early on, that this is something, and maybe a little bit of belief in my head, as I had those aspirations to build on those things I felt like I missed out on in my thesis. I really felt like I needed to do it on my own initially. So yeah, don't be afraid to reach out to those around you. As I've said, I've found so many enabling factors at Grampians Health, and so many clinicians around me with more experience willing to help. And then outside of your work network, don't be afraid to think of other networks you might have and be able to create discussions with them. For example, for me, it was previous university lecturers as well. The other thing that I've noticed that I wish I knew sooner is to be patient. It is a very long process. Again, I probably had the perception from my thesis, because it was relatively rushed, that I'd be a lot further along the process of where I am now. So yeah, if I think back to my thesis, that was sort of completely done within sort of 9 to 12 months, whereas this I'm 15 months into the project and very much still working on all of the background side of things, still working on my protocol proposal, still working on the ethics application. So still a long way to go. So be patient with it. In terms of, and probably my last sort of discussion point is around my future plans in research. As discussed earlier, it's very much been a learning opportunity for me, this project, and I see it as, for lack of a better term, almost a bit of a pilot in learning this process. It has been a process I've enjoyed, although I'm honestly currently not sure what's next in terms of my research journey. In the short term, I couldn't see myself going to do any higher study, such as a PhD. As I touched on before, my priority is being a clinician, and something that I genuinely love doing. And as I said, why I got into this role as an EP, into this career path. In saying that, I could realistically see myself pursuing another research project through my work here at Grampians Health Ballarat. Although what that may look like or be within, I'm not sure, but I do hope that I continue to build on these skills and knowledge, and who knows, maybe help to mentor others in the future as well. But yeah, at this stage, my main concern is working through this current research project. So yeah, I'd just like to thank Olivia and the Western Alliance and Deliver team for inviting me to speak, and thank you to everyone who's attended to listen to my insights on my own journey pursuing research. So yeah, thanks again, everybody.
Thanks, Jai. That was wonderful. And to hear that you are keen to continue on your research journey, and that you're even looking at mentoring others, that is absolutely music to my ears. So hope to see that, and I'm sure that we will. So thank you so much again for sharing your experiences and insights. So I'm sure there'll be some questions for you. But in the meantime, while people are thinking of those, I am going to invite Georgie Kemp to present now. So I am hoping that I've shared the right screen, although I don't think I am. Jai,
No,
how's
that's okay.
looks okay?
Yeah.
Yep. Awesome. Okay. Well, Georgie is the Director of Allied Health and Ambulatory Care at Grampians Health, as I mentioned. After completing a Master's by Research, Georgie has worked in regional healthcare leadership roles since 2009. Georgie believes that research methodologies and thinking can improve healthcare outcomes and can also be a significant enabler for recruitment and retention of healthcare professionals to rural and regional settings. We've got the exact right person to be speaking to this audience. So welcome, Georgie, and over to you.
Yeah, thank you. Thanks for the opportunity to the Western Alliance and Deliver, and to you, Olivia, in particular for agreeing to drive my slides in lieu of me being able to do so myself. So this slide, I'm sorry, there's a bit about me, and I think it's important in the context, but feel free to leave at this point. So I was an experienced clinician working in a regional area, and I felt like research would be a good option for me. And so I looked at the options, and really there was two main options. One is that I could do something in the area of my clinical expertise, which was falls. And I found a university supervisor who would supervise me, but really had no expertise or interest in falls. And also the workplace was probably pretty fluffy on whether they would support me in doing anything at work. Or the other option was to join a really established research group in Melbourne, had a very clearly articulated project, really experienced supervisors who knew exactly what they wanted done, but that was to be done completely separately from work and needed me to go to Melbourne. I actually chose number two because the general advice was if I was actually going to get this thing done, it would be much better to be joined as part of a research group. And the other thing was that it allowed me access to supports, like not just my supervisor, but the Melbourne University had a whole lot of research subjects and postgraduate free courses in subjects such as presentation and research writing, all those sorts of things. So I did a Master's by Research, and I did that during my spare time and also with using annual leave, and worked full-time as a clinician in that time. And really the two things were completely separate worlds. Even when I asked for some days of professional development leave to get my thesis started, which is, really the hard bit where you actually start writing, but I really had to fight for that because the leadership was kind of arguing back, they had a reasonable perspective that actually there wasn't a lot of value in the organisation for me to be doing this particular project. So I completed the thesis, I got some publications, and at that point decided research was definitely not for me. The reasons for that were probably, firstly, I was tired, but I was also frustrated by the conversations at the university where it felt like there was lots of talk about where you could get funding and how you could get publications and what conferences were coming up. But I never really heard the research team talking about things that clinicians and healthcare managers talked about. It seemed like two completely separate siloed worlds. And when I looked at the patients that I was seeing as part of my research, they didn't look anything like the patients that I was seeing in my clinical work. And so I felt like I didn't want to go into this sort of university research because I didn't want to get detached from the so-called real world. I appreciate university, but also real world. But I was also disillusioned with the opportunities for me in my organisation, that as a clinician, I wanted to stretch my development, but I'd had to do it in my own time. I'd had to travel to Melbourne, so I couldn't really do it based where I was. And I had these two completely separate worlds. So what to do? So I gave up both. I left my job, I didn't do research, and I went and travelled the world for a year. And I'd already done a lot of travelling. I was trying to make an effort of establishing a career, but at that point I was disillusioned with it all. And when I came back from overseas, I actually ultimately worked in Melbourne because I felt there were better opportunities for me. And whether I was a loss to the research world or the clinical world is debatable, but I was a clinician who was based in a regional area, and because I didn't feel that I could pursue career opportunities I had left. And I don't think that's a good thing. But eventually I did find my way back into a regional area, and now obviously I'm in a sort of a management career. But my experience was 15 years ago, and things have changed a lot since then. And there's far better collaboration and co-design with patients, carers and clinicians, and involving clinicians in research is a far more established thing, but obviously it's something we still want to work on. I do strongly believe that clinicians and healthcare leaders should be involved in research, because you're going to get an improved dissemination of the findings, better implementation, and hopefully more effective in the treatments or in things in the real world. Jai's really beautifully outlined some of the factors that support clinicians to do research, and the next slide is looking at some of those things, but I'm not going to go into it too much, but just to say, I've also got a bit of a long-term view of this. So Grampians Health has had a range of research positions in allied health over many years, and the way they started is not the way they are now. So they've become far more embedded in the kind of business as usual. So Alicia, our research translation lead, she's part of the Allied Health Council. She has good working relationships with allied health managers and clinicians, and she's sort of part of the furniture. And she is here on, wherever you are in Grampians Health, you will see her. And I think that's really important, that people are kind of visible. Jai talked about the education and training, and I think that's incredibly supportive. Jai also talked about the MERI Council, and MERI, which I love an acronym, but MERI stands for Monitoring, Evaluation, Research and Improvement. And so I'll show you where that came from in a minute, but basically it's trying to develop, and Alicia's very much taken carriage of this, a supportive community of practice. So we get a clinician, they come in and present their ideas, and they're often quite new. And the idea is that this group is really supportive, and it includes researchers, managers, clinicians who have a particular interest, and a consumer who's absolutely brilliant. And all of those people are there to support the clinician by giving new perspectives, ideas, offers of assistance. And Jai also talked about, it's really important that they can introduce you to other people. So you suddenly you're not doing it on your own. You've got a group of people who are supporting you to do your research. Jai talked about having people around him, leaders around him who understand research and really support him to do the research. And actually the pulmonary rehab team and that exercise physiology team are a good example of teams that have been involved in research and quality improvement for years. And so it is very much part of their culture. And those people can really help ensure that the research is relevant, contained, realistic, and also really work with the clinician to adjust workload to help get the research done. But they are still clinicians, they still have to deliver healthcare, and that's a tension. But a manager or a senior clinician can be incredibly supportive for that. So going on to the next slide, talking about managers and leaders, because that's probably the perspective that I know most now. It's really important that research activities, I think, align with service and organisational priorities and the current context. So in terms of context, Grampians Health is a relatively new organisation that is spread over a wide area. It has rural and regional and quite small sites and much larger sites. And if we're going to be doing research, it would be lovely for us to do something that's about our context in terms of delivering rural and regional healthcare. And our context is very different from somewhere like Monash, who might be aspiring to world-class. I think one of their goals is world-class research or those kinds of things. And so I think it's important to look at the organisation in which you're working, or the service, and to try and make research part of normal operations. And you want to be able to have it be seen as a way to address key issues or strategic priorities. So one manager I spoke to said that when they're looking at prioritising their quality or research initiatives, they either, they do the SWOT analysis, strength, weakness, opportunity, threats, and they try to look at their weaknesses and threats and say, can research or quality improvement really help us with these things? I think research needs to be part of the solution for facing the very many wicked problems that are facing healthcare leaders. The other thing is sometimes as a leader or a manager, you've got so many competing priorities. And I think my experience is certainly in the past that research was seen as a nice to have thing, but it wasn't part of the way you did things. But I think that if you're a leader or manager, then it is clearly part of your role to ensure clinical governance. So if you go to the next slide, this is the Safer Care Victoria Clinical Governance Framework. And you can see where research can fit quite nicely into some of these petals, shall we say. So certainly around best practice, are you embedding evidence-based practice? And see around the edge, you've got that monitoring in evaluation. So that's where the MERI came from, monitoring, evaluation, research and innovation, but it kind of came from that framework. So to try and have a coherence between all the things that we're trying to do. Going to the next slide, which is back to the same slide we had.
Sorry, Georgie, did you want to click on this one or move to the next?
Yeah, no, this is good. The support for research is not unconditional. As a manager, it absolutely can't be. It can't be at any cost. Managers do have to juggle multiple pressures, and the key things they're probably juggling is cost, access, and quality of care. And all of this is compounded by workforce issues. I don't think it's a secret that the financial environment is becoming increasingly difficult. And for better or worse, income in public health is often linked to seeing patients. So if a clinician is not seeing patients, there's not income coming in to support their time. So either we don't get the funding or someone else has to see more patients in order to cover the person who's doing the research. That's just the reality of it. And so that's a real challenge. And therefore funding such as scholarships or research grants are really helpful. It doesn't usually cover the full cost of a clinician doing research. We all know how much time it takes, but it does definitely help get people over the line. And I think I've kind of said that you want to have it as part of the normal way that you do things. I do think you need to have leaders who are demonstrating that research and quality are really important to them, and building it into structure so that it's in team meetings and it's agenda items, and research is a really visible part. The other thing is that for managers to have sort of these ongoing and collaborative relationships with researchers. So I think researchers and managers sometimes I reckon people get frustrated with each other, but they need to understand each other's perspectives and challenges. So I know there's frustration that evidence can take years or decades to be implemented into practice, but it also needs to be acknowledged that interventions can be less effective in the real world than they are in tightly controlled trials. And also research is operating in a really, university-based research, shall we say, has very different sort of key performance indicators and funding limitations to public health care. So to give you an example, I saw this great research into the effectiveness of virtual monitoring, and it all just made perfect sense. It looked like a beautiful model of care and everything. And so, why don't you implement it in the real world? Well, the problem is that the funding doesn't support it. You can't generate any income from virtual monitoring. And so it's not really fair to get frustrated at managers to try and implement something for free. And so it's trying to understand that. Now, I'm not saying that the funding model shouldn't also change, And I think policy makers need to be involved in that as well. But there are really real limitations to being able to actually, I hate to use the word, but operationalize some models of care. Next slide. I really believe about the recruitment and retention value of clinician-led research. So we know workforce is a massive issue in healthcare, and people want all kinds of things, but what they do want to be able to do is develop themselves as professionals and develop their careers. And many people will leave a particular area or a particular organisation because they can't have access that development opportunity. The other thing is that, yes, people want to go so-called up in their career and, you know, get more and more seniority, as it were, but they also want agility. So they want the ability to try something different and maybe go sideways for a while and then maybe come back. You know, and ideally that's what happens, that within an organisation, someone can go and do a project for a while, then go back to being a clinician, do some research as well as a clinician, go into some education, move into a management role, go and work at a different site. Just, you're still staying in the organisation and the region, and you're still connected to the community, but you're trying different things, and you're getting, you're on the learning curve, as it were. And I think the thing about healthcare workers is that for many of them, that they love to learn, they love to get better and better at what they're doing. And so that lifelong learning. And there's recently been this healthcare workforce paper put out, but really the good workplace, you're valued, you feel like you're making a difference, and you feel like you can grow professionally and personally as well. So I think being part of research is a great option for that. And next, other thoughts. So Jai's talked about patience, and patience is really important, not just for individual projects, but just for the benefits of research overall, I reckon. So, and I can only say that with the benefit of hindsight, because it can be easy to look at a specific project at a specific time and say, look, that's not really a priority right now. Honestly, I'd rather the clinician do clinical work. But the problem is there's never a good time in public health care. There's never a time where you've got money, time, headspace, and you're ready to go. You never feel like that. So sometimes you just have to get started. And I believe that even, and I believe it from my own experience, but also from watching others, that even if the specific project doesn't work out or get finished, and please try to finish it, because it is really, that is the hard part, it's sticking the landing. But even if the clinician decides not to pursue research, there's many benefits from being involved in research. I know for me, it really honed my critical thinking, and it made me more and more ask questions like why, or how do I know, or how can I prove it? And that helped me to hold myself accountable, and then, you know, when I'm in management, holding others to account as well. You know, and I go back to my, or actually, even when I'm working with managers at the moment, one of the things on their position descriptions is, you know, one of their key accountabilities is to make sure they're running a high quality service. But, you know, when you ask people, are you, and they all say yes, because they really believe in their clinicians and what they're doing. It's actually pretty hard to prove it. It's pretty hard to actually know for sure that you're delivering high quality care. And that's a really, really important question. And I think even if you're not doing, I don't know, research, but research thinking can really help you with that. So the other thing about, you know, just some of the skills. So my written work, one of my supervisors was just so rigorous. So she had this really eagle eye for, she'd just get a pen and just scroll through it and just go, nah, this information's unnecessary. This thinking's confused. This evidence doesn't match the arguments. She was just at me. to communicate more effectively, as it were, all killer, no filler. So it's such a great skill to be able to distill like an 80,000 word thesis into a 200-word abstract, or to try and summarize years of work into a 5 or 10 minute presentation. And sorry, there's just a net call going off. And delivering healthcare and trying to further develop our services, we've got to be able to put together effective business cases, and they've got to work. They've got to have punchy executive summaries and solid evidence. I've got to be able to, and the manager's got to be able to really sell our ideas to people in finance and leaders and CEOs and funders. And you've got to know how to present data in a really influential way. I did do a really good workshop once on how people use data to trick other people. And I think I was supposed to take it as, don't do this. But, you know, there are ways of presenting data that can influence people while being completely correct. I also love the research presentations. Sorry, going back to that thing. So sometimes I see data presented and I'm just like, that the way that it's scaled or something, it's not really indicative of that. And so, you know, I think you're a bit more rigorous in the way that people are presenting things. I love the tight timelines that are enforced in research presentations, and wish that more of that happened in healthcare. You need to be able to deliver your message quickly and persuasively within the time frame that you're allocated, and then you still need to have all the content knowledge to answer the questions that come your way. So I wanted to be a researcher. I never got there, but I know that my experience in that area has helped me contribute to the research of others, and hopefully to contribute to a culture where we can see learning improving as a key pillar of delivering healthcare. Thanks.
Thanks so much, Georgie, for that. And look, in the nicest way possible, I'm glad that that didn't, you know, that whole Melbourne and research thing didn't work out, because now we have you in our region supporting and enabling research. And yeah, so really, really big thanks for all your work and for your presentation today. I have no doubt that there are lots of questions among our audience members. So if Jai and Georgie are happy to hang around for a few more minutes, I'd just like to open it up to anybody who does have a question. Everyone's stunned. I might just kick it off then if I can. I've got one for you. I've got lots for you, Jai, but I'm gonna just stick with one for now. You mentioned in your presentation that one of the limitations of your thesis was the incompleteness of the outcome measures that you were interested in. I'm wondering if you feel that there has been a change in that, in the completeness of the measures now that you're sort of taking that research lens, and you know you mentioned that you're working with your team to do your research. Is there a bit of a shift in the way that people complete these measures?
Yeah, definitely. The pulmonary rehab team are very big on making sure we've got our spreadsheet that we routinely collect our data on, and I'm pretty confident to say we wouldn't have missed anyone's pre and or post outcome measures putting that in. It's just become standard practice for us in the pulmonary rehab team.
Thanks, Jai. So just another example of the way that research can influence quality
Correct.
practice.
Yeah, correct.
Thank you. We've got a comment in here from Anna. Oh, lots of comments. Sorry, I've missed all of these. But yeah, research thinking is useful. I completely agree. Any other questions for Jai or Georgie?
Olivia, I've got a question for Georgie. So Georgie, great talk, thanks. And it's fantastic having you supporting research at Grampians Health. Just wondering, how do people work with the managers to get the priorities or to know what the organisational priorities are? Do you have hints around that for clinician researchers that are coming through?
Yes. So most organisations have like it's kind of big picture, isn't it? So it's looking at the organizational strategic plan that outlines the key organizational thing. And then what is supposed to happen from that is that it cascades down to what does that mean for how can my service contribute to the overall success of the organization, and it trickles down. And so in an ideal world, and we haven't been in one over the last number of years, but each of the managers will work with their teams to put together their kind of strategic priorities, and as I said, also identify their key issues that they need to deal with. I honestly think it is about being in constant conversation. So it's about being in the forums where the managers are discussing these things in meetings. It's about those informal conversations. And it is also, I think, about having regular, quick catch-ups with managers to sort of talk about, like, what is it that you're really struggling with? And, you know, is there any way that you can see that research can help with that? And as I said, there's some really key areas, I reckon, around like at Grampians Health, we've got multiple organisations and sites kind of joined together, and we don't have we'll have the same program like pulmonary rehab delivered in slightly different ways across different sites. And so how do you pull that together into a service that is evidence-based as much as possible, that it looks the same for a client regardless of what site that they enter, and that the clinicians are all working together. So that implementation of translation of research and evaluating services as well. And I also am pretty flexible about research and quality improvement. I just see them all as part of one continuum, and I'm not very, I actually did at one stage used to be quite, that's not research. I'm not at all like that anymore. I just care that people are asking questions and evaluating their services and doing something about it.
Terrific. Thanks.
Yeah, thanks. Oh, sorry.
Anna.
Thanks, Georgie. I love that point, you know, about it being on the continuum, and that's the way we like to see it too, you know, where we just want to see evidence in practice. And sorry, I'm on my phone, so that's why I haven't got my camera on.
Thanks, Anna. And Akusha?
Hi, it's Akusha from speech pathology, and really nice segue from Anna's comment and talking about a continuum. Just fortuitously through the middle of this presentation, I got a text message from one of our previous staff. So Rishni Pereira started with us as a grade 1 speech pathologist, who one of her initial goals in her first PDR was that she was really keen to do research. So she went through, she was here only for about 2.5 years, I think. And during that time, she and Ellie Orr managed to get a STAR seed grant of $5,000 to look at, actually, which I might be familiar with some of the screening processes we use in cardiopulmonary rehab for patients with COPD. They've just had their first paper accepted into Dysphagia, which is an international journal, which is very exciting. They had lots of support from Alicia along the way. And I believe also went to the Mary Committee as well. But Risha's just sent me an email. She went off to the Austin, and they sent me an email to say she's very excited, but she's been accepted to do her PhD at the University of Queensland, where she'll be supervised by both the Austin and UQ, looking at frailty-induced dysphagia. So for someone who started with us in 2019, who's sort of gone through that journey, she's going down that path of pursuing her dream in research. So it's just another story. And I think, as Georgie talked about and Jai talked about, the STAR program and the Mary Committee and the processes we have in place have really supported staff who want to pursue their passion, or perhaps do a sideways step as well. But I just thought that was a good news story, and it was just very timely.
Thanks so much, Akusha. That is such a wonderful story, and I remember Rishni too. So that's really nice to get that update on where she's at. Thank you.
I did seek permission. I said, "Can I share?"
Love it. Oh, that's great. We've still got a few more minutes. If anybody does have any other comments, anecdotes, or questions they'd like to share. I might ask one more question if I can. Georgie, you mentioned another enabler being collaborative relationships with researchers. I'm just wondering, from a sort of practical perspective, any relationships that you do have with researchers, have they sort of been things that you've deliberately kind of sought out, or have they been sort of more organic relationships that have come about?
It's kind of all of the above. It's a smorgasbord of ways, I think. And I think, you know, sometimes we have have clear alignments with certain universities or research groups, and you can see how, you know, it's a real win-win. But at other times it is about either our organisation is trying to reach out to people to work together, or universities are coming in to us. But you know, because it's so networked and people are all connecting, what you want is all kinds of people connecting all over the place, and all these kind of unexpected ways that people kind of join together, and then people work here and then they go to UQ and do their PhD and they work with Austin, and so you just build and build and build on those networks, I think. So I do think that it's probably over years and probably more organic than really, I think that's probably more the way that it goes.
Excellent. Thanks, Georgie. Well, if there's no more questions, I would just like to say a really huge thanks to Jai and Georgie once again for sharing so generously your perspectives and experiences, and everybody who has come along. And I've just seen a last minute question come in from Jackie to clarify what the Merry Committee is. Can we maybe just quickly do that before we wrap up?
Do you want me to do that quickly, Georgie? Excellent. Thanks, everyone. I'll try and this is Alicia. I'm the Allied Health Research and Knowledge Translation Lead from Grampians Health and one of the Research Translation Coordinators from Western Alliance. So the Merry Committee was set up within Allied Health in response to providing a support network and also a method of, I suppose, a bit of oversight of the projects coming through Allied Health along that continuum of service evaluation right through to bigger level research ideas. Essentially, it's a monthly committee that's been set up with clinicians, managers, a consumer, and people bring their project ideas to us and present them, and then we can accordingly allocate resource ideas, put them in the right direction, and basically give them the support within the organisation that they might need. And that's the very nutshelled version, and I'm very happy to be contacted outside of the session if people want more information.
Thanks, Alicia, and for the question, Jackie. So I can certainly connect you with Alicia if you like outside of this forum. All right. Well, I think we are pretty safe to bring it to a close, and thank you all once again. And I hope you enjoy the rest of this beautiful sunny autumn afternoon. Thanks, everyone.